We're here with Dr. Wigoda today talking about celebrity plastic surgery. Hi, Dr. Wigoda.
Hey, how are you?
I'm good, thanks. So today we're going to talk about Joan Rivers.
What happened to Joan Rivers?
What happened to Joan Rivers? Why don't we take a quick look at a picture of a young Joan Rivers in a really excellent 80s picture and a picture of Joan Rivers today, age 75.
All right, if you look at this picture of her, I don't know how old she was here, but she was probably at least in her 40s. One of the striking things is that she's actually very plain looking. It's not anybody you would actually notice if you walk by her on the street, whereas now you would definitely notice her. So maybe that's an improvement, especially if you're a celebrity. If you look at her, we'll start with her lips. She has very small lips. Compared to what her nose looks like now, I think she probably had her nose done here, but it looks like she's probably had it done again looking at her more recent picture. If you look at her cheeks, she has very flat cheeks, and as compared to now, she has these full cheeks, which actually make her look a little bit odd today. And that's really what I get out of looking at her picture from whenever this was, when she was probably in her 40s or early 50s. If you look at her picture now, let me just pull that up.
No problem.
Well, we could start with her breasts. They're definitely larger now, and it could be that the dress is pushing them up, but I wouldn't be surprised if she had breast implants. So again, looking at her older picture, it looked like her breasts were on the smaller side, either an A or B cup. Going back to her face, again, her nose is definitely a lot thinner, so she's definitely had her nose done since this picture was taken. She's probably had her nose done a few times. Again, her cheeks are quite full, and clearly she's had a facelift, and probably a mid-facelift, which is where you lift the cheeks up. She may have also had the cheeks filled with fat or radius or some kind of filler. What happens when the cheeks are that full is the nasolabial fold, which is this fold between the cheeks and the lips, is quite deep, which actually makes people look older. We actually fill that fold in with a filler like Radius or Restylane or Juvederm. She has very few wrinkles in her forehead and around her eyes, suggesting that she's had Botox, and I'm sure she would freely admit to that. But overall, she's clearly had too many procedures. The one thing I would give her is that she has almost no wrinkles for her age. She's 75 or so in this picture, but she's definitely overdone. And again, with makeup, it's hard to know exactly what's going on underneath the makeup. Her eyes actually look pretty good. Just from a aging standpoint, she has very few wrinkles. She doesn't have any excess hanging skin in her upper eyelids. So there are some good things here, but I think she just is a bit overdone. Too much plastic surgery.
So if she were your patient, what would your advice to her be? Stop the procedures now?
I would definitely stop all surgical procedures on her. I think she can continue with the Botox. Her lips are a little bit fuller also, so she's probably had them filled with Restylane or Juvederm, which is fine. Her lips look fine. I might fill up her nasolabial folds a little bit. I definitely wouldn't do anything to her cheeks other than possibly take out some of the fat. And I think that would be it.
Okay, well, thank you, Dr. Wigoda, and we'll see you next time.
Okay.